Breathing is an automatic function for most of us, and we only become aware of it when we are putting our bodies under considerable stress, such as strenuous exercise. That increased awareness, though, drops off very rapidly when we rest and we stop exercising and the increased demands fall away. However, for some people this isn't the case. Their awareness of breathing discomfort can occur at rest. This is true for people with underlying heart or lung disease, or with other serious conditions that cause them to become easily fatigued. Anxiety itself can cause this sensation, but can also be a consequence of it. When this awareness becomes intrusive or frequent, we call it breathing pattern disorder or dysfunctional breathing. Dysfunctional breathing can affect anyone at any time. Sometimes it is misdiagnosed as asthma, particularly in people who have past histories of asthma. Breathlessness has many different causes. In fact, the inputs into our breathing are very major, although we may not be aware of them, and they're coming from the increased demands, sometimes also from our mood and our feeling and our thinking. And each of these inputs has varying potential to affect our awareness of breathlessness. But also by mastering some techniques which we're about to show you, you can actually bring yourself back to a very normal breathing pattern and relieve your breathlessness. We're going to show you how you can use these breathing techniques at any time during your everyday life. We'll teach you how to make your breath out last longer, encourage you to breathe in always through your nose. And we want you to avoid taking very deep breaths.
Diaphragmatic or abdominal breathing, sometimes called relaxed breathing, is a basic technique that's often used in yoga and also meditation. So we're going to practice that today. But before you do any breathing exercises, the most important thing is good posture, because good posture is good breathing.
Slumping squashes your lungs and it prevents you from taking a normal breath in. It will add to your sense of discomfort, not help it.
So I'm going to get you to sit up straight, feet comfortably on the floor, and shoulders relaxed. If you're not sure if your shoulders are relaxed, a good technique is just to hunch your shoulders really tight up towards your ears and then let them go. So I want you to do these exercises with relaxed shoulder and nice relaxed posture. And the technique is breathing in through your nose for the count of 2, not too big a breath, but slightly bigger than normal, and then out for the count of 3 to 4 with a little pause at the end, a little bit like a rectangle. Hand on tummy, so you're encouraging yourself to bring the breath lower rather than up here where you're using your shoulders. So let's try that. In through your nose and out through your mouth. With a little pause at the end before you breathe in again. In, out. A little pause at the end before you breathe in again. Out, very good. Keeping your shoulders nice and relaxed. And each breath out, trying to relax just a little bit more. That's the way. Can you feel your belly moving? Good. You can also do this breathing in and out through your nose if it's more comfortable. But again, following that rectangle. In for 2, out for 3 to 4, pause at the end, in again, out, pause at the end, and so on. So repeat. Do you want to try that? And you're breathing in through your nose and out through your nose for the count of 3 to 4. Pause at the end before you breathe in again through your nose and out, and relax. Practice these exercises for at least 5 minutes every day, because then you will find that they come much more automatically when you need them. Sometimes when you feel really breathless, you'll automatically want to reach out for your puffer, and you don't really need it, especially if you're taking your preventer medication as recommended by your doctor.
Sometimes you can become over-aware of breathing or have a feeling of panic. Stop what you're doing. Adopt a comfortable position. Relax your shoulders and chest. Slow your breathing down. In through your nose for 2. Out through your mouth or nose for 3 to 4, with a slight pause at the end of the breath. Continue with relaxed breathing, in through your nose for 2, out through your mouth for 4, until your breathing settles. Say to yourself, I will catch my breath, I just need to give myself time. Stay in this comfortable position. Don't move from this position until you're completely recovered. Some previous studies have shown that people with asthma can dramatically reduce their use of their reliever inhaler by using the breathing techniques first of all. On the other hand, if you use these techniques and you're not relieved, do then take your blue puffer if that's appropriate. And if you don't get relief, we want you to seek medical advice.
When you have lung and heart disease, breathlessness is part of your everyday life. But when you increase your activity around the house, walking up hills or stairs, that breathlessness increases. And there are some ways you can manage that. Firstly, the position you adopt. So a lean forward position is a good position. So let's try leaning forwards on your knees. So this time it's going to be pursed lip breathing. So when you breathe out, you're going to be breathing through pursed lips, as if you're blowing on hot soup. So in for 2. Out for 4, in for 2, out for as long as you need to feel as if you're relaxing, usually at least 4. Fantastic. And you can use this at any time with any activity. Whenever you feel that breathlessness becomes overwhelming, you can stop and do the pursed lip breathing.
There are many techniques that you can use which are simple to employ in your day-to-day life. These include things like pacing your activities, taking your time, making sure that you actually have time to do the task you're setting out to so you can take some frequent little rests if you need them. Bracing yourself against a wall, the back of a chair, even your shopping trolley if you're out shopping can be really helpful. When you are doing some physical activities, a sitting position can be very helpful if you have underlying heart or lung disease that makes you breathless very quickly. If you're folding clothes or preparing food or getting dressed, sitting down can really be helpful. This video is made for everyone who wants to improve their management of breathlessness and breathing discomfort, whether it's due to underlying lung or heart disease, or whether it might be due to breathing pattern disorder. It's best if you watch this video several times and practice these techniques regularly so you can use them in any situation and you feel you have mastery over them so that they feel automatic for you. We encourage you to look at both the Lung Foundation of Australia, Asthma Australia, and the Severe Asthma Toolkit website.